Hello and welcome to Acupuncture Professional. It's Kath Berry here, and it's with great pleasure that I introduce you to Isobel Cosgrove. So today's program is actually centered on what is mentoring, what it's all about, and what we'd love to do is encourage you to please participate in today. We would love to hear from you. That of course it's lovely to hear Isobel's perspective, but she can offer you more the more that you contribute and participate. And the best way to do that is if you look on your screen, you've got your user control panel that sits on the right-hand side. You can either text and type a chat if you don't have an audio feature available, or you can actually speak to us through your audio function. What I'd love to do to start off with is actually ask you a question and ask you to put up your hand or to type into the chat whether you are currently actively involved in a structured mentoring program. So if you could just quickly chat that into the chat pad for me, and while you're doing that, if you can also let me know where you're dialing in from today, and then I'm going to hand over to Isobel once we've got that information come through to you. So please take a moment to chat that into us now. So again, the question is, are you involved in mentoring, and where you're coming in from today? So we've had two responses. Both the people who've responded aren't involved in mentoring presently.
Right.
We've had a couple of people coming in saying good morning. So we know we've got Helen from Barcelona, Karina's coming in from Sydney, Australia, Rosalie. Joe's coming in from New South Wales in Australia and not involved in much mentoring. So what we're going to do today is to structure the webinar in a way for those that aren't currently involved in mentoring. So the focus really will be around what is mentoring and how can it help you in your acupuncture practice. So I'd now like to hand over to Isobel Cosgrove, who is the founder of the British Acupuncture Council mentoring program, with over 40 years of clinical experience and a whole range of mentoring across different health sectors. Isobel is the most perfect person that I know in the world to be able to talk to us today about that. So thank you for joining us, Isobel.
Thanks, Kath, and hello, everybody. Really nice to talk with you. I feel as if I'm blind because I can't see you, and I'm used to being with groups that are in the room with me. So I'm having to visualize who you are, where you are, and how you are. And I just want to say that it's a real pleasure to be introducing this subject to you. It's a subject I feel really passionate about, and it's kept me in the acupuncture profession for 40 years, and I'm still really enjoying my practice. And that's my goal for you, that you can thoroughly enjoy your practices and they become the thing that you want them to be. You individually, there is no one model for how a practice should be. It has to be your practice and it has to work for you. So what I want to say is, this is how we start a group. I introduce myself, say who I am. Kath said a little bit about me. I work in London now. I've worked in the mountains of Wales for 20 years. I taught at a college in Leamington for 10 years. And I've been running supervision groups for the last 25. And have developed a network in the UK. I've also worked with people in Germany and in Canada, setting up networks there. At the moment, I'm introducing some mentoring programs into the Herbal network in London. So think about where you are in your practice. These are the questions I want you to ask yourselves today. How do I run my practice? What is my experience? Do I feel comfortable with clients? And if not, why not? Who is working well with me and who isn't? Am I stretched or overstretched? Am I tired or not tired? How do I revive my energy? And is there room for change? Do I want more clients? How could I generate them? Have I difficult cases? And what is the difficulty? Can we talk about it in this group? Is it the diagnosis? Is it the treatment? Is it the relationship? Is it getting them to come regularly, pay regularly, talk? What is the problem? And do they understand their health issues and how to get better? And finally, we need to ask, is our work satisfying us? Do we have the input and support we need from peers, from people like me, supervisors, from CPD organizers, from facilitators in the region? And how could I improve the input I get? What is my plan for the next stage? So those are the questions that I'm asking you today, and I'm asking you to bring really to your self-reflection. And I, as your mentor today, what I offer you is a confidential setting. Everything that happens in this group is entirely confidential and professional, where you can examine a range of work issues, for example, cases or patient management. It's probably one of the few very unbiased spaces where you can find support for yourself. Because if you're living locally and having peer group support, there's always an element of competition involved. And here you come into a mentoring setting where the entire focus of the group for this hour is about supporting you to get your practice doing what you enjoy. At every stage in a practitioner's life, actually, it's important to have input. It's clear that as a new practitioner, you want support to actually grow your practice. But actually, for me, 40 years on and in my 70s, I want mentoring for myself to decide how to scale down my practice. And in the middle of all of that, when you have a big practice, how do you manage the demands that that makes on you? So for every stage in practice, beginning, middle, ending, we all need support and input. And we need a safe environment in which to explore our practice issues. And the safety is provided, first of all, by the confidentiality issue that I've mentioned, which is that nothing goes out of this setting except that you can talk about your own work. You talk about no one else's, and that's an absolute given. The other way in which it's safe is that over time, a group develops trust in the people in the room. And my job as the facilitator is to establish that trust. And I do it by making sure that the way we talk to each other and the way we ask questions is enabling exploration rather than closing it down. It's a non-judgmental, non-critical, enabling environment which makes it safe to explore. And that is an absolute given. And you can imagine, actually, that it takes more than an hour to establish trust. So one of the ways in which Kath and I are experimenting with this online mentoring today is to say, how are we going to explore in a safe environment and build the trust that we need? And I have a question about, are you interested in following this session up? Are you interested in meeting together as a group and feeling like you have a supportive environment to work in? It's often hard when we get together to quieten our critical voices and to be non-judgmental. It requires practice. And it's my job to say, hang on a sec, that was probably a little bit verging on the judgmental. Can we step back a bit and ask a different question? Because sometimes we get a little bit pushy. In our desire to help others, we can be a little bit pushy. And we have to step back and really slow down and wait. And listening is a critical, with awareness, listening with awareness, really finding out what the person is saying, asking another question to really understand where they're coming from. This is the important thing. So what else do I need to tell you? My job is to make sure that we don't have criticism in the group, that it's a safe environment, that it's an enabling environment, that it's a confidential environment and a professional environment where we focus on professional issues and we don't go too widely into life issues. If you're having trouble with your children, I'll probably say to you, go and find someone who deals in family issues. This is a professional group. How do you, in your working life, keep your self-reflective thread? Do you, at the end of a working day, write a few headlines about what's happened and the questions that are still in your mind? Do you put that down? And at the end of the week, do you survey those questions and put them together? And then at the end of the month, do you collect the 4 weeks together so that you've got the recurrent questions that emerge in your practice? And if that's the case, you can bring that to a mentoring session That's how we work. So there's the session itself, and then there's the self-reflection and the work that you do yourself in your practice. So not only does mentoring require a commitment, if you're in a group, to the group itself, but it also requires a commitment to your own self-reflective practice, which is quite exciting to think about, because it means that you're going to have more of an internal dialogue, an internal conversation with yourself about how you work. And it has to be a continuing thread. Otherwise you lose and the issues fade. This seminar should be an empowering experience for you. It should give you some tools to take away into your practices. And by asking questions which are on the top for you at the moment, you can give yourself those tools. I don't want to just make this a lecture. I'm doing an introduction to say what mentoring means for me and what it means for you. But now I want us to have more of a dialogue, and I'd like to have some questions from you about actually what is happening in your practices. Is this the moment, Kath, to include the question that we had, a written question?
That's true. That's true. That's a great idea. And what I'm going to do also is just ask the audience, which I've done now. How long have you all been in practice for? Because it was very interesting, Isobel. And it hadn't occurred to me that when you mentioned that, in fact, your professional issues are about winding down. A lot of the contact that I have from people is really about how to gear up, how to scale up, how to go from a small practice into a large one. I know Karina sent an email last night saying wanting to know how to sell acupuncture more, how to get out there more. So that's a very different professional issue than perhaps once, looking at transitioning. Again, I'm in an experience of coming back to a practice after being on maternity leave, and all of a sudden realizing my practice has to be a lot more flexible in a way that it wasn't pre-children. So all of those different issues. So what I'd love to do is hear from the audience. If you could just type in for us how long you've been in practice for, and that will give us an idea again of how to tailor the questions for you. And I guess I've got a couple of questions about mentoring before we go on, Isobel. The example you just gave was how you participate in mentoring in a group. What's been your experience in mentoring one-on-one? Would that be a first step for somebody, or is it really a personal choice as to whether they go into a one-on-one versus a group situation?
It's personal to the person. The advantages of one versus the other, just let's look at that. If you go into a group, you don't just have the support from me leading the group, you have the support of the group. So in this case, if there's you, there's me, and there's everybody in the group coming in with enabling questions. So that's a bigger and a more resourceful environment than just one-on-one. However, some practitioners don't want to leap straight into a group. I really understand that. And so I do quite a lot of one-to-one work with newer practitioners who want to explore practice issues in a more private setting, just one-to-one. And then maybe after a year of doing that, maybe we meet every month for 6 months, and then every 2 months for the last 6 months, and then they move into a group. So it's a preparatory stage, often for new practitioners, and it can be something that suits other people all the way through their practice life. They prefer one-to-one. For example, my husband has been doing one-to-one herbal supervision for the last 30 years, first of all with Giovanni, and then more recently with Ken Lloyd. And he's taken in specific case studies, and they work on the prescriptions. And really, that's one-to-one work. So both of them have their strengths.
And how would a relationship like that develop for somebody listening today who has obviously made the commitment to be here to find out more about mentoring and to hear from you your experience with mentoring programs? What would be your advice on that first step in choosing somebody to be an ideal mentor? Given sadly I'm not aware of any countries to date in the world. The BXC obviously has a very structured program that you've introduced, but otherwise it seems to be very much practitioner led. That you're given your qualifications to graduate as a practitioner, and then you said go off and be a good one. And with that in mind, practitioners now, and I'll just feed back to you that we've got someone with 14 years experience, someone with 9 years experience, 8.5 years, one with only they've just graduated as of January this year, 5
Yeah,
years in practice, 16 years in practice. So, our practitioners today are, fairly long standing,
varied, yes.
and all women that, some have had breaks as well. So, it's
Yeah,
been really interesting to sort of see that and think, how do you go about, having identified that mentoring is important, how do you go about finding someone to fulfill that role?
right. I had to go outside of the profession to find a mentor because there were no mentors in the UK in 1989. So I had someone who came across from the States and worked here for 3 months every summer. And I joined a mentoring group that she ran. And it was so helpful to me. And after she went back to the States, I had to look for someone else. And so I found someone in London who I still see for mentoring, who trained as an acupuncturist and then as a counselor and therapist. And she has been giving me. So you have to find someone who's got some training in mentoring skills. And my experience in the acupuncture profession is that there's a lot of top-down CPD, a lot of, I'm now going to be completely non-PC and say that there's a lot of middle-class, middle-aged, white males running the teaching of the profession, who then go out into the community and say they're offering mentoring when actually they're teaching. Mentoring is a very different experience. It's a level experience. It's the kind of experience, conversation you and I are having today. It's a level experience where both practitioners, you bring your questions, I bring mine, and we explore together to enable both of us to work well. And you have to establish that. So whoever you work with has to understand that and has to give up being the expert and the one who knows. Because that ultimately, long-term, in a mentoring context, is actually disabling. Because you end up feeling less than rather than equal. And that's one of the critical things to remember about being in a mentoring setting, that the person who's facilitating one-to-one or group is not an expert in how you should run your practice. They can bring their experience and skills in to ask the questions which will allow you to develop further and grow the practice. So that's essential. And that is quite difficult to find. You may have to go slightly outside of the profession, or you might have to say to someone, here is a book I'd like you to read. Are you willing to follow the guidelines in the book? Showett and Hawkins, mentoring in the helping professions. Read these guidelines and help me by being my mentor. So that would be the way to go if there isn't an established network and if there aren't people, because we train people to be mentors in our profession. We train probably half a dozen people a year. We do it every 2 years with a dozen people. And over the last 20 years, yeah, we've trained 200 people. And they're out in the community now.
And from your experience, and obviously when you're talking about we, you mean the British Acupuncture Council and what's happening in the United Kingdom.
Well, the British Acupuncture Council didn't do the training. Right. They weren't interested. They thought that mentoring was for needy people, which is such a lot of rubbish. So they didn't support this. They came in 2016 when it was already established.
Oh, how fabulous. Well, congratulations for independently getting that program set up.
And the other 100 people who have driven it, it's been a collective effort, actually.
And as part of that network of people, is there an expectation that those, how does it work in terms of, for our audience today, that they'd like to participate in a program like this, that you organise a time that it's a paid arrangement, that it's almost like as you would pay any other, an accountant or a business advisor, that you pay your mentor, and that's
it's usually it's usually equivalent of a treatment fee. It's an hour's work. You come together for an hour, you do an hour's work, you come with your agenda and you work through your agenda with the facilitator. So it definitely actually is a piece of work that you do and you pay the facilitator. I think the BAC is now interested in really educating people about this. And so they may be offering some free groups so that people can go in and find out about it. Because I've written a couple of articles every year for 20 years about mentoring and put it out in all of the journals, eJOM and Acu and everything else.
And this is it.
But
One of the
reading is one thing.
yeah,
You
and
know,
one,
you need an experience. I think you
this is
need an
right.
experience like this. Actually,
This
yeah.
is it. This is it. And this is what I'm really excited about. That of course, it's very experimental what we're doing today, but with a view that we've got 8 people, 9 people now on the call today. That being able to actually say, actually, we're going to progress this, and we're going to use the model which you've developed in face-to-face settings, but actually take it into an online arena. And one of the things I loved that you mentioned in your introduction to what is mentoring was you made a point about practitioners actually journaling what they're doing in their practice,
Yes.
that daily
Yeah.
note taking. As you would, in my mind now, I'm imagining our businesses as a bit like a patient, where you come in and you do an assessment and you look at what, the strengths and weaknesses of someone's constitution. You look at the immediate crisis point as to why they've come in to see you, which is the equivalent would be why you're seeking mentoring. You then, from that, you go through a judicious process of deciding what needs to be done to solve that
Yeah.
problem, and then you
Yeah.
set a plan in place. And obviously the
That's
note
it.
taking, that being able to measure it and record it and track it and monitor and reflect, that all of those processes are an aspect of, effectively almost seeing your practice like a patient which needs, support.
That's exactly it. If we offer treatment to the whole person in our practices, which Chinese medicine does, in mentoring, you get CPD for the whole person. You don't just get it for the head. More information, more knowledge, which is fine. You get it for you to support you in your practice, actually. So it mirrors, as you said, that's a nice metaphor. It mirrors what we offer our clients. We have to give it to ourselves. In fact, that's how I've sold it to the profession. I said, we offer help to our clients. It would be nice to offer some to ourselves.
Indeed. So with that in mind, I'd now really like to hear from our audience, and just to clarify, there's a couple, just the language that we're using. CPD is continuing professional development, and that can sometimes mean what we're doing, education points or your certificates that you get for hour. But in this context, continuing professional development is about personal and professional growth in your professional life. So we just had a question about CPD and that sort of the definition of that. So I'd now really like to hand over to you as an audience member. If you could just sort of let me know when you're ready to speak, and tell us a little bit about your issues, where you're up to in your practice, and in how Isobel today through this mentoring process can help you. So I'll just give you a moment now. And if you just indicate to me when you're ready, and I'll unmute your audio. So just say yes, and I'll bring you in online. And I just encourage you not to be shy. That that you've spent time, you put time aside today, or to be part of the group. So we'd really love to hear from you, and certainly know that this is a safe environment in which to share. And just while we're waiting to do that, I'm actually going to go to a question that was emailed us from a member that couldn't, in fact, make the live session today. And this is emailed in confidence simply because she wasn't able to participate. But she said, I've built up a full-time practice in 4.5 years with about 30 patients per week, and it's a good list as well, has a good list and reputation. I'm exploring how best to exit. Now, if I was a physio or chiro, they're all set up with means of marketing and selling their practice, not just the buildings, but their databases, the website, their lists, and the goodwill as well as mentoring. But of course, as acupuncturists, we're not there yet. So, oops, I've just lost the email. So the question really is around how do you go about the process of moving practice, of selling a practice? So for those that are, for anybody that is currently running a practice, and this is a bit of a passion point for me, because of course, we spend our professional lives building up a business, and the idea that one day when it comes to retiring, that we're quite literally going to turn the lights out and close the door is really sad, that there's no succession planning, that there's no way of actually commercialising all that work or the goodwill and all those relationships that have been built up. So the question really is around succession planning in a business, how to sell an acupuncture practice and move on and then of course setting up in a new place. Isobel, you mentioned earlier that you started in Wales and you've moved to London and you've run different practices. You've actually gone through this process. Perhaps you could share with us your experience, what you did, and how you might advise this person.
Yes, I've moved twice actually, and I've handed on my practices twice. And actually, your client who wrote to you isn't in the group, so we can't ask her to answer any of these questions. But I'm going to read a series of questions which I made a note of after I'd looked at her issue and talk a little bit about those questions in relation to how I moved. My first question to you is, are you advertising to sell your practice? And if so, where are you advertising? And I would make some suggestions to her about how she'd do that. Then, do you have a local network of practitioners in your area? And if so, they're the first people to go to ask and to meet with and talk with. Do any of them locum for you when you're on holiday and therefore know your client list already? And they actually are going to be the people who may be interested in taking part in your practice. Have you had any students from colleges who have actually come into practice with you? Some colleges make this a requirement in the third year. And we had in Wales, in our practice in Gower, dozens of people come in and work with us. And one person in particular came in 3 years running. Interestingly enough, she then locumed for us once she'd qualified. And then guess what? She came to work with us and she took over the business with 2 other colleagues. And that's how I sold my business. And guess how long that took? 3 years. 3 years minimum. Actually, my husband was traveling for another 2 years after that to transition. But we did it by introducing our whole client list to new practitioners over a period of time. And it really, really worked well.
From a financial perspective, though, I mean, a student who's just graduated, it would be very difficult to find someone that's in a financial position to make that transaction, to that handover. Was there a graduated plan in place? Or, again, there's,
Yes.
and you don't need to disclose the nitty gritty, obviously, in confidence, but it's that understanding, that it's not like selling an entity in any other business. Somebody selling a fish and chip shop. It's a very different process than selling an acupuncture business and the relationships and the database.
This is how we did it. She came in as a new practitioner and we referred clients to her for 3 years. And every client she had referred to her, she paid a treatment fee for. So she paid a referral fee. Mm-hmm. And over a period of years, that amounted to a number of thousands of pounds.
Yep.
And so she paid that.
Was that per introduction, or was it every time she delivered a treatment to that client? So
no.
Was it a commission or simply like an introduction fee? Or
it was a referral fee. Okay. Someone on our waiting list was referred to her and she paid a referral fee. And then the client was hers. Then the client was hers afterwards. And so when she said, I want 2 people to work with me and take this practice over with me, we had a guideline to the amount of money that had taken her to build up over that time. And so everybody else paid the same fee. So collectively, we were paid for selling on our practice to those people. But it took 3, 4, 5 years to do it because we mentored them into the practice and they met clients over time during being students and coming into the practice and meeting people, during locuming sessions, and then as they were moving in and taking on their own clients. And they would come, yeah.
So my question with that, so say for example, a person buys an agreement like this is made with an acupuncture practice, and as you said, there's a referral fee per new client that comes in through that lead, for example, through that avenue.
Yeah.
Say for example, you've built a website, and somebody comes across the website and comes in through that avenue. Technically speaking, that's still your referral. However, it would appear that they were a walk-in off the street, even though it was your resource that you built.
They've built their own website. They've done their own website, and we've brought ours to London and changed it.
Oh, I see.
So we didn't do that. We actually handed on the client list And there are ways, we took legal advice and we had a legal contract, and the lawyer advised us about how to do that and how to hand over legally. So we took advice about it. But we didn't sell our website. We sold the goodwill, the reputation, and the client list in the practice. And each time a person was handed to them during our stay and afterwards, we had to give permission for that client to be moved. So there's a lot to take on board, and it's a big event. And I know over the last 30 years, I've watched people try to sell their practices quickly, and it doesn't work. So that's why we did it differently. Because trying to do it quickly, the clients are disorganized, and if they've got a chance to go somewhere else, they may do, because they need a period of integration. So the people coming in to take over the practice need to come in and meet with and go in on treatment in order to transition properly, actually, is my experience. If that doesn't happen, at least half a dozen practices that were being sold in Wales while I was there, they put on the market, they were going to be sold, and then the sale collapsed or the transfer collapsed. So it isn't easy to do it, but it is possible if you're willing to put in the work. What we did was we moved here in 2010, and we were still transitioning in 2015 by going down once a month to Wales. But no big deal for us, because we'd been coming up once a month anyway to London for mentoring. So we would go down to Wales once a month and do 2 days of practice and mentoring with the people taking over our practice.
Right.
So that's how we did it. And I did it before that when I was teaching at the Leamington Clinic, and I had a big practice there. I took 2 years to transition and hand over my clients then. So it isn't a miracle that I've handed over 2 practices and moved on. It's just a piece of work. And I feel really satisfied with how we did it. Actually, Kath, and to all of the people who are listening, I wrote an article with Gwennon, who took over the practice, the initial person, and then 2 other people joined her. But she and I wrote an article together talking about how we handed over. And it's in an edition of the Acu in the UK about 3 or 4 years ago.
Great. I'll chase that up then. That sounds like an excellent resource.
It's in detail. So there's quite a lot of information available from me, and your client, if she wants to, can ask further questions. As everyone can on this.
And I think it does. It raises that issue of it's a professional issue of how you manage your business as a business entity, and that very critical point at which your clients ultimately end up with a personal relationship to you. And it's then having to, how do you extract yourself from that relationship, during times of illness, or times of leave, and obviously during times of exiting, and that idea of actually leaving in total. So again, I'd like to hand back to our audience whether there's any questions that have come in. That I know, in fact, I got an email from Helen, and I'll bring Helen in a moment, who had a question for you around palliative care. And of course, Isobel, having conducted a webinar last year looking at how to best manage patients or working with clients during an end-of-life process, that I thought that you'd be an ideal person to talk to about that palliative care question. So, Helen, I've now got you unmuted. Would you like to introduce yourself and speak directly with Isobel?
Good morning, Isobel. Good morning, Kath. Very nice of you to do this.
Hi there, Helen.
Hi.
Hi.
I have a question concerning people that are in the end of their life, and most of them are really ill.
Yes.
How can you actually help them without forcing them out of life? Some people in Holland, it's a real big thing, I mean, get morphine and then they end their life. And I don't think there is the right support, to be quite honest. Because leaving this earth is something very personal, and it involves more than just the person that's dying. And I don't know whether it's the person that's dying that wants to go through all of the motions, or the people around it. And how can you help the person that's dying as well as the people around them? You know, you can counsel, you can do a lot of things. And I've done that for the past few years because I had a very different practice.
Mm-hmm.
But I would like to use the needles to give people the opportunity to move in the way that they want to move.
Okay. It's a really interesting question, Helen. And I think we have a unique opportunity as acupuncturists, actually, because we can focus on the fact that the body is dying, but the spirit is still there. And I have a 5-element and TCM background. I was trained by Worsley in the 1970s. And then later in the 80s, I worked with John and Angela Hicks doing TCM. But for the first really 10 years of my practice were entirely 5-element. And we worked a lot with the spirit of the person in the treatment room, not just end-of-life clients, but all clients. And it's particularly true that we have an opportunity at the end of the life. So what happens for me when I'm working with patients who are dying is that I use a lot of points on the chest, high up in the body, on the kidney meridians, the stomach meridians, the spleen, and the heart.
Okay.
And I don't know, I don't know what your training was, but mine was that kidney 24, 25, 26, 27. The last 4 points on the meridian are particularly helpful. And I took that into working with dying clients, which I did a lot of about 10 years ago in Wales. And it was very, very helpful. I could see that it gave people a process.
And at what stage would you start that? Because I have a few clients who have cancer. Some of them will probably make it and some of them won't.
Yes.
At what moment in time do you actually start this process?
Well, I mean, I also use those points with people who aren't dying. If they're in a lot of emotional distress, which is pulling their spirit down, I'll use it. But I would specifically say that I'm mentioning them now in answer to your question because I think it's about end of life and about connecting with their own spirit and the greater spirit at that time.
It's actually really coming home.
Yes, exactly. So heart 1, heart 2, blue-green spirit, and the top points of the stomach and the spleen meridians. Very abundant splendor. Points that have a sort of nourishing sense of filling up with spirit at the end of life.
Okay, that sounds really lovely, Isobel.
And the other points that are there too are on the back, depending how ill and how mobile the person is. The outer bladder line points on a level with the back shoe of lung and heart are important because of ending with the lung dying and the heart. So there's outer bladder points. Yeah, outer bladder line.
That's very logical. Thank you.
Yeah, you're very welcome. Really appreciate your question, actually.
I always find it. Yes.
No, go on.
I always find it very intriguing, the last moments in life, how people do their last breath and how they leave their spirit through stopping with the heart. And, it's very touching when that happens. And I think it has to be done with dignity.
Absolutely. So, of course, the relationship you have with a person is incredibly important at this time.
Very, yes.
Yeah.
Yes.
So I wouldn't want to overlook saying that, the actual use of those points is accompanied by your willingness to be with the person in that way.
Yeah. Yeah.
But it sounds like you're doing wonderful work, actually, Helen. So I just want to appreciate that.
Yeah, I'm having very lovely clients.
I know it's a gift, isn't it? It's a real gift. Yeah, it is.
Definitely. Yeah. Oh, thank you very much, Isobel.
You're welcome.
Well, I actually have a question, Helen. When we were in a different meeting a couple of weeks ago, you mentioned having a
Yeah.
client with conversion syndrome.
Yes.
Now,
A young girl.
do you mean psychogenic non-epileptic seizures?
No. It is, what happens, they get all stressed out and all of a sudden their body just doesn't want to move anymore the way they want. And it looks like they have a physical disability.
Yep, yep. I had a client. The reason why I was thinking of you, I had a client. I have a new client with this condition. So I mentioned to Isobel in preparation for the webinar today that that I've had the most extraordinary thing happen in my acupuncture practice, and it was just this week of having a client come in for an unrelated condition, but in part of the assessment, she says I have non-epileptic seizures. And she said, I haven't had one for 6 months, but just to let you know. And during the course of our treatment, she became very distressed when she was talking about a previous relationship and a long history of abuse. And she basically, through the process, became very honest and open about her life trauma. And after about 30 minutes of talking, she said to me, I need to let you know I'm about to have a seizure. And then she did. She had what I've since found out the medical term is a psychogenic non-epileptic seizure, a PNES, otherwise known as conversion disorder. And I thought that was so fascinating because you just raised it only a week or two ago in our conversation. And have you seen your client have one of these seizures?
No, she hasn't had any of those. Throughout the day, she's just very tired. She eats, but she doesn't eat lots. She sleeps, well, from 7 to 7. Her eyes are very, how do you call that? It's like there is a haze before them. And it really makes me think of stomach 40 to open all the orifices.
Yep, and the damp, clearing the damp. Sure.
She can think clearly, she says. I think she has been stressed out for a very long time. Her parents have divorced. She graduated last year from middle school. She now has to make choices to what her university college thing is going to be. And all of a sudden, everything just stopped. She just couldn't move anymore. She has no emotions anymore. Mm. So, and that being an 18-year-old, that's really very contradictory, really, isn't it?
Yeah, and it's been interesting because having had this episode with this client, and again, Isobel, I've honestly, it was the most intriguing and extraordinary thing that's ever happened to me as an acupuncturist. And the reason why I was so pleased that it's happened now at this point in my career. I think if this happened 20 years ago when I first started, I wouldn't have been able to cope at all. But as I'd only seen her, it was only the second appointment I'd ever seen her, so we didn't have a long relationship. That I'd already knew that she had a history of these particular episodes, and it was really extraordinary. What I'm going to do is actually send a link to show you what one of them looks like. I found a YouTube video of a group of professionals describing what it is. And this seizure went for 5 to 10 minutes. That I knew to expect that it was going to be long, and I timed it. I wanted to make sure that she didn't go over the 10 minutes because that's what she said was normal for her. So it was I just thought, Isobel, this was the most interesting experience to be in practice, to have an unexpected, I would call it an adverse event, having somebody have an episode like that inside an acupuncture practice. What was surprising for me was I didn't feel in any way anxious or concerned. I wasn't worried for her safety. She was sitting on the table, but she wasn't violent enough that it didn't look like she was going to appear to fall, that there was actually an element of control over it. It was very spasming, and she was touching herself, touching her face. There was a lot of this sort of activity, making a lot of noise. Her tongue would protrude, and it was really the most extraordinary thing to observe. And it made me realise how alone we are in an acupuncture practice, and thinking that these events do take place, and just I was wondering if you've got any thoughts about an episode like that, an encounter like that, how to advise me.
Well, it's good that it wasn't too violent for you, because if it's violent, then you obviously have to be more concerned about the safety of the client and try and get them on the ground so that there's not going to be a fall if they're on the couch. So that's the first priority, to see how violent it is, the seizure. And then once you've got them into a safe place, which you had because there wasn't too much movement, then you have to wait and watch. And it's not obviously, you have to take out all the needles. If you've got needles in, you have to take more. Yeah. So all the needles come out immediately. And then you wait for it to end. And then it's about drinking water, making warm, sitting down, and having a talk about.
Yep.
And, you know, I mean, as acupuncturists, we are going to be able to help with seizures because it's usually profound deficiency and a rush of liver wind into the body, which disorganizes the whole metabolism into a fit. And the liver wind is usually the symptom of severe blood deficiency or severe kidney or other deficiency that you can pick up from the pulses.
This woman has a. I was thinking about whether this is because her presentation's damp heat. Would this be something you would classify as phlegm, fire, misting the heart? Have you?
No, yes, I know about phlegm, fire, misting the heart, but that's more of a mental condition than a physical condition. That is when somebody goes slightly off in a mental sense and slightly manic.
Yeah.
So I've treated quite a lot of phlegm misting the heart.
Yeah, so because I've only ever seen phlegm, fire, misting the heart in my previous work was around patients with mainly heroin addiction and different drug and alcohol addiction. So cocaine and cannabis can often cause that as well. So I was trying to work out, does it fit with the same pathology? But you're saying it's a liver wind. It's
more liver wind. I think it's more liver wind, and it's a rush, uncontrolled rush of energy through the meridians.
Yeah. And it seems it was offset by her talking about her history of trauma is probably the best expression, history of trauma.
Yeah. So you're going to have to pay attention to not only the trauma in your treatment program, but also to the deficiency which has come in as a result of the trauma. Because trauma often blocks any kind of input and nourishment. Yeah. And then the person gets severely deficient.
So what would be an advisable next step in terms of...
Well, I would certainly get her checking in with her doctor and say, I've had another. So I would get it, you know, and then I might say to her, can I talk with your doctor? You know, is it possible for me to have a conversation? So that you're not on your own. Sure. You're quite right. You want to reduce the isolation. You're doing it by talking in a mentoring setting. And that's absolutely the other thing to do. Take this to a mentoring session. Get a sense of how people have responded to it. And then in the practice, when she comes back, you know to expect it. You know it's not too violent. You can put her on the couch again. If I had a violent episode with a client where the person was at risk of falling, I probably wouldn't put them back on the couch. I'd have them in a seat. I'd seat them so that I can have more control over them if they had another seizure. So,
And Helen, how does that apply? I'm just thinking about it with Helen as well, because Helen, it sounds like your client is in a very similar situation, although but how often are your clients' seizures?
No, she hasn't had any seizures yet. But I just looked up that conversion disorder, and it's called a functional neurological symptom disorder. Right. So it is the same, except within the DSM-4 there are different stages really where they go through. And mine hasn't had seizures. She is going to a clinic in 3 weeks' time, where they specialize on. What is it called? EMDR?
Yes, exactly. Yeah, that's right. Should be required to wear a monitor for 24 hours.
They actually use the same points that we use on the head, that we would use our needles on. The thing is that one of the doctors said she really welcomed acupuncture, and during her intake last week, I got put on a sideline because that doctor said, well, there's nothing proven there, so not going to do that. And I'm like, okay. And there was an issue with getting money from the insurance company. because they said I didn't fill in the requirements, but well, as far as I know, I do. So I can't really lay a finger on why this is happening. But I'm keeping very close contact with the patient and her mother. And I found a blood deficiency. I found a kidney deficiency. I haven't found liver wind because she doesn't have tremors or anything like that.
No.
So what I was doing up until last week was feeding the kidneys, feeding the blood, doing all sort of things like that. And I actually was at the point where I was considering doing ear acupuncture, because that goes straight to the brain.
Yeah.
But that was the moment that they said, no, you can't come anymore. Right. So it's a bit of an awkward situation at the moment.
Can I just interrupt, Helen, to say that this is a really good example of how a mentoring group works, because we've got a client, Kath's got a client, and you've got a client, and there's similar things, and you're able to compare notes and talk, and the value of that is absolutely brilliant. So I really want to appreciate that. This is how it works. I'm just talking to everybody now, as well as Helen and Kath. This is how it goes. This is how a group works.
And ultimately, it's about, when you're working effectively on your own, it's then sort of going, okay, how do you then, as you say, your advice, Isobel, about contacting the doctor, and then Helen's situation is that doctors shut her down. That's actually she's been blocked as an opportunity to work as a team there. So she's effectively been told, you're on your own, but the mother's involved, so that there's a different element of support. Or
every situation is unique in this, and every doctor is unique in the sense of whether they will work with you or not. And we just have to keep exploring and keep doing it, and have a lot of determination, Helen. Somebody else will be more cooperative than that particular person.
The thing is that the client, as well as the mum, would like to do acupuncture. But she's a single mum. Her daughter doesn't have any income, so they run into a financial problem. She bakes very, very good pies, and she sells them. So I thought to myself, I can make an arrangement, because I think at the age of 18, being in this situation, wanting something but you can't afford it, shouldn't be a way to lose out.
I agree. Maybe you're going to be paid in kind, Helen.
Right. I think, but even in kind, as it can be that they sort of they advertise me because I'm good at what I do.
Exactly. We've all done things like this in our practices, and it's valuable. So we get, it's a satisfying way to work as well, even though you're not getting your full pay for it.
I don't care.
Yeah. Did I see on my screen that there was a question from George? Was there? It came up, a Spanish question, and I didn't. It just flashed up on my screen, but maybe it's not.
It hasn't come into me. No. But I just actually want to make a comment about that situation that you're in, Helen, with having somebody that can't afford treatment, and it's a big. I know for a lot of people in all different stages of their practice, that idea that your altruistic desire to help, and I loved, Isobel, your expression saying we're all in the helping profession, and then the financial reality of needing to run a business, and often the clients in the greatest need have the lowest means to be able to pay for treatment. So with that in mind, how do you marry those two together? And I remember having a really interesting conversation with somebody involved in one of the multi-bed clinics in the UK, and the multi-bed being a shared facility where people pay a lower rate, but they are in an open plan community environment. And his view was very strongly that healthcare shouldn't be free, that you should never provide acupuncture for free to your patients. And it was an interesting kind of idea where he said, even patients that are on the lowest lowest socioeconomic group should pay, and even if it's £1 or $1, €1, that there's actually something very important about there being a financial transaction, and that you get to choose. Helen, you could choose what you thought was a and I'm thinking €5. I'm thinking that it's a small amount, but it's enough that there's a commitment involved, that it's somebody having to, it's more than coins, that there's a note that somebody has to make that contribution. And
€5 and a pie sounds good.
€5 on a pie, or €20, whatever, €20 to a pie, whatever you charge. But actually, that the moment you're involved in a transaction where you're actually doing it for free, I would question, maybe this is something for another.
I completely agree, because it skews the relationship.
This is actually been
the relationship has to be solid. The relationship has to be solid.
One of the issues in healthcare across the world, but particularly the NHS and what it's done to people's value of healthcare in the UK is destroy it. By having a system of absolutely free healthcare that people can walk in and there isn't any sense of responsibility over their transactions. There's this sort of, the sense of entitlement. It's a really interesting concept of the NHS free model of care, which I think healthcare should be available to all. But that idea, the moment you have something where there's no transaction in place, you don't get the buy-in or the commitment from the patient in a way that you do when there is a fee-for-service system. I don't know, Isobel.
There's no awareness of the input in time and the input in having done an education that puts you in a position to help someone.
That's right. There's a transaction. There's a transaction there. There's a contract. A contract is being made with that payment, and where both parties are agreeing to the outcomes of the contract. Isobel, what are your thoughts on that? I know you're.
Well, I think that one of the problems with the NHS, and I want to be mindful. Do we have any questions waiting at the moment?
We don't. We're just in our wrap-up stage now, so we can,
fine.
Reflect.
I think one of the problems in the NHS is there's a hugely top-down attitude from doctors. Doctors are the experts. Doctors know, and doctors don't ask clients to take responsibility for their own health by taking steps to maintain it. And there's no education that goes on within the NHS. It's beginning to happen just now, sort of 60 years later, it's beginning to happen. But over my lifetime, and my lifetime mirrors the NHS, it's always been doctor knows best and do what you're told. And that is not something I ever want to see in the acupuncture profession. And I never want to see it in mentoring. I don't like expertism, and I don't like people being the possessor of knowledge and you're out there and you're less than and we will give it to you. And one of the most important things about a mentoring session like this one is that everybody comes in with their own contribution in the way that Helen did today, actually, and everybody has got something to contribute. Everybody has, particularly the client. As soon as I can, in a patient practitioner setting, I get the client, I say, okay, this is teamwork, this is my job, and this is yours. So we're working together on a level footing, actually. And that's true of mentoring as well. Yeah.
Excellent. Well, just in keeping with time, I'd like to thank everybody for coming along today. And really what we've done, I sort of feel like we're just at the beginning of a new exploration. That the idea that we can, in fact, continue these smaller groups. What I would look at doing next time is having people so we can see your videos as well. So it's not just Isobel and I on screen, but that and there was a question that came in around would this continue to be confidential? So that's a really important aspect we can explore further. So Isobel,
everything we've spoken about is confidential today.
And is there anything in summary that you'd like to say before we wrap up and close the webinar?
Well, I wouldn't be in practice today if I didn't have the kind of mentoring input I've had from Giovanni, from Maggie McKenzie, from Terry Jenner, who worked with me over the years. And I think that all practitioners should have this available for them, and that it will take time, but that I wish the people who have been on this program would think about giving that to themselves in whatever way they can. And certainly you and I, Kath, will work hard on finding a way to make it work for them. Yeah,
absolutely. Absolutely.
This is the cutting edge of mentoring. This is a first. This is a first.
And I think following on from what you first said, what I would love for everybody on the call today and watching the video to say, please go and start a journal. please write down at the
Yeah.
end of each day that, you know, your wins, your insights, your, you know, things you'd like to improve, so that that journal becomes your book or your map to be able to become the better practitioner, you know, within a mentoring context. So that's something that we can all do and start today. And I think it's
and that will feed into the next session. That will feed into the next, and you can start writing your questions now for the next session.
This is it, and that self-reflective practice, which I think is so important. I think we all do it, but perhaps in an unstructured way. So being more structured and starting to take on our business as we would a patient, keeping really meticulous notes, planning ahead, and keeping a clear vision of what the best outcome is. So thank you again, Isobel Cosgrove, and thank you, Helen, and everybody who joined us today. And you know, again, we're in this fantastic uncharted territory, and thank you so much for being part of that.
Thank you, everyone. Bye.
Bye for now.
Thank you. Bye-bye.
Bye.